Hey guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, physician assistant, and former CMP examiner. So today I wanted to come on and do a discussion about hypertension as it relates to PTSD and other mental health conditions. So many veterans are service connected for hypertension, and there are several ways that people can get connected for this. First thing I wanted to do is come on and discuss what is hypertension, right? So hypertension is often referred to as high blood pressure. Many lay people just say high blood pressure. Is when the pressure in your circulating blood against the blood vessels is higher than what most medical professionals would deem normal. Okay. So the World Health Organization refers to high blood pressure as a systolic pressure, or the top number being over 140, or the diastolic blood pressure, or the lower number being over 90. Okay. You can also have pre-hypertension, which is generally when it's above 120, the systolic number, but anywhere from 120 to 139, or that bottom number, anywhere from 80 to 89. I don't want to get super confusing by talking about a bunch of numbers, but hypertension is generally, or high blood pressure is generally referred to as a systolic or top number over 140, and the bottom number or diastolic being over 90. Okay. So how do veterans get service connected for high blood pressure? Well, high blood pressure can be service connected on a primary or direct basis if you are diagnosed with high blood pressure while you're on active duty. Okay. So if you were treated for high blood pressure, if it was diagnosed on active duty, that can be a way. Now, that's not to say if you had a high blood pressure reading once or twice that necessarily means hypertension. Typically, you're diagnosed after many people use something called a 3 or a 5 day blood pressure check. So they may have you come in on a series of days and record them in a controlled setting, meaning you haven't, you're not sick that day, or you're not maybe doing a bunch of PT and smoking 5 cigarettes right before you come in. They usually have you come in, sit down for 15 minutes calmly, and then record it, right? And then they do it 3 or 5 times within a couple of week period. Okay. So just having one high reading doesn't necessarily mean that you had hypertension, because things like being sick, or, the blood pressure cuff could be not the right size, or mechanical equipment issues. Usually it's a diagnosed condition after several series of readings. Okay. So if you're diagnosed in service, a lot of veterans can be service connected for their blood pressure, for high blood pressure, if they go on to file a claim for that. Another way that you can be service connected for high blood pressure or hypertension is on a secondary basis related to other conditions, right? So I've done a few videos on hypertension in the past. You guys are more than welcome to go and check those out. They may be also informative, but today I wanted to talk about it as it relates to mental health conditions. Okay. So I'd like to start off by saying I'm not an accredited agent or a VSO or an attorney. I'm not a legal expert, right? So you may want to discuss the facts of your case with one of those types of professionals, as they can guide you in the filing process. I'm just a physician assistant, like I said, former CMP examiner, and I review a lot of files and write reports based on what I review. Okay. So whenever I look at a case for hypertension, I like to look at, I look at the whole case, right? So I look at what are your risk factors. So your people will have modifiable and non-modifiable risk factors. Okay. So some non-modifiable risk factors would be like genetics, right? Do you have a family history of high blood pressure? Do you have, some other type of disease that predisposes you to it, right? So some modifiable risk factors, let me go back to non-modifiable. Also, it being over 65 could be one, and other disease processes. Like I said, if you've got, one kidney, right, that may be a non-modifiable risk factor, because the kidneys help regulate and control blood pressure. Okay. So some modifiable risk factors would be things that you are under your control, that are modifiable by you, that can contribute to blood pressure, right? So things like weight, right? Smoking, unhealthy diet, physical inactivity, alcohol, okay, stress, right? So there's a lot of things that can contribute to high blood pressure. So when I look at that, I look at everything, and I look at, if somebody has they're a smoker for 40 years, they have a strong family history, they've got one kidney, I might not say that someone's PTSD, in my opinion, is the cause of their high blood pressure, right? But I balance all that information that's positive and negative to try to formulate an opinion, okay? So when it comes to PTSD, sometimes you may have several factors, and I include all of those. Like if you've got a lot of anti-inflammatory use due to orthopedic issues, or you've just got pain, because pain can increase blood pressure, I may include that as well. But when it comes to mental health, stress is definitely a component. So I've been trying to give you guys a couple snippets of information and studies that I like to research and use. That way you guys can like find them, look them up, give them to your doctor, see if they agree or disagree, and can write a short statement for you. Remember that letters from your doctor are never required, but they can be helpful. So one of the articles, let me pull them up. One of the first articles that I like to use, just about mental health conditions in general, is called Anxiety Disorders, Hypertension, and Cardiovascular Risk, a review. And that was published in the International Journal of Psychiatry and in Medicine in 2011. Looked at a link between anxiety disorders and hypertension. And it states that in particular, psychological stress, psychosocial stress associated with anxiety disorders raise autonomic arousal via the hypothalamic pituitary axis, which increases circulating catecholamines. So all of that, there's additional information in there, but all of that leads to precipitating high blood pressure, right? Another article, Hypertension in Relation to Post-Traumatic Stress Disorder and Depression in the U.S. National Comorbidity Survey, published in Behavioral Medicine, looks at the relationship of lifetime PTSD and depression and high blood pressure. The impact of post-traumatic stress disorder on blood pressure and heart rate in a veteran population, published in the Journal of Traumatic Stress. Also took a look at some of those things. So there's several different articles. I've got a bunch more, but I'm not going to go into a bajillion of these. Also, I always like to touch on this. If you have obesity related to another service-connected condition, in this case, possibly PTSD or depression, that can also be used to discuss how your weight has impacted your hypertension, right? Now, that's not to say it's just lifestyle choices. You just like to go to McDonald's or whatever. I like to go to Chick-fil-A, right? If you like to go to one of these places and that's just your lifestyle, then that's what it is. But if you've got mental health stuff that is impacting your diet and exercise because you're stress eating, maybe you have a comorbid bulimia or some other type of eating disorder, right? And you're service connected for it. That can certainly contribute. Lack of exercise as well. So if you're not exercising because you have a social phobia, you don't like to leave the house, you don't like crowds, et cetera, those things can definitely contribute. So I hope this was helpful. I wanted to, real quick, I'm going to touch on the ratings, right? So I don't represent clients, but I know a lot of times people like to know the ratings. These are always subject to change. So I would say make sure you follow up with whoever is assisting you in the filing process if you have questions on this. But generally speaking, if your diastolic or your bottom number is between 100 and 109, or your systolic pressure is 160 to 199, it can be 10%. If your diastolic number is 110 to 119, or your systolic pressure is 200 or greater, it's 20%. If your bottom number is 120 to 129, it's 40%. And if the bottom number is 130 or higher, it can be 60%. Now, a lot of veterans will ask me, well, what if I'm on medications and it helps control me and bring me into a normal range? Well, you can still be service connected for it, right? And so you might be service connected at 0%, but if you develop other cardiac conditions later in life that can be tied to it, or if your blood pressure becomes non-controllable as you age, it can always be increased, right? So I hope this was helpful. Please drop some comments if you guys have any questions about hypertension as it relates to mental health disorders. Please like and subscribe to the channel. I appreciate everybody hanging out. And I will talk to you guys soon. Thanks a lot.